In this short video, we will show you how the ExpertCare Hypertension tool can revolutionize the way you manage hypertension reviews. There are 3 ways in which ExpertCare can be used to easily manage medicine reviews. ExpertCare guarantees clinical safety, meets all information governance standards, and can be used by any qualified clinician. Let's start with an opportunistic consultation. The clinician measures blood pressure and enters the reading into the patient's record. In this instance, the blood pressure is high, so the clinician opens ExpertCare. From here, it is a quick 3-step process. Step 1. Check the patient's details and blood pressure reading, and confirm the patient's comorbidities. Anything no longer applicable can be excluded. Step 2. Confirm the patient's current medication. Any medication not applicable can be excluded. In the third and final step, you are presented with treatment recommendations, which if applied, will ensure compliance with NICE. In this example, you are going to replace the drug class with the recommended drug class. You can up the dose for lisinopril and continue the dose for indapamide. When you are done, you can save a PDF with all your recommendations to the patient's record. NICE-compliant patients have better controlled blood pressure. The average time it takes to use ExpertCare is only 3 minutes. For face-to-face hypertension clinics, ExpertCare can be used in exactly the same way as shown previously. So, what about virtual reviews? These can save considerable practice resource time, as well as patient travel time. For virtual reviews, firstly run a quick risk stratification across your hypertensive patients using the UCL Clinical System tool. Select the relevant patients from the list. If a patient requires a blood pressure reading, use AccuRX to request it from the patient. When the reading is provided by the patient, it is automatically placed in the patient's record, and the clinician is notified in the AccuRX badge. You can now open that patient record and run ExpertCare following the same steps shown previously. Save the PDF to the patient's record, and send a message with AccuRX requesting approval to change medication. Once the medication change has been approved, open the patient's record, open the PDF, and make the changes in the prescribing module. You can then use AccuRX to inform the patient that the change has been made. A reminder is set to request a new blood pressure reading in 5 weeks. It is estimated that this method could save a PCN with 50,000 registered patients, 1,800 clinician hours, assisting you in making a dent in your backlogs. Most importantly, better blood pressure control equals fewer heart attacks and strokes. For every 50,000 registered patients, optimized treatment of hypertension could save approximately £82,000 per annum.